Since July 2017, Monica Hendrickson has been the public administrator for the Peoria City County Health Department. She initially began work at Peoria City County Health Department in 2009 as emergency preparedness planner until she left in 2010 to be the director of health protection as Knox County Health Department. She returned to Peoria in 2013 as the agency's epidemiologist until she transitioned to her new role, which is no longer a new role for her, but it was at that time. Mrs. Hendrickson received her MPH in 2008 from the University of Michigan School of Public Health and her BS in 2005 from the University of Illinois, Urbana-Champaign. Who do you cheer for?
In basketball, I'm an Illini.
Okay, there you go. There you go. Smart move. Maybe not so much in football yet, right? Okay, I didn't think so. Additionally, Mrs. Hendrickson served in the Heart of Illinois United Way as a board member, Solutions Council member, and grant reviewer, as well as a member of the Phoenix Community Development Services Board, the Trillium Place Board, and the Illinois Health Facilities and Service Review Board. This July, Mrs. Hendrickson will begin her new term as the Illinois Association of Public Health Administrators President. Right. Lucky to have her here. She's also a member of the Partnership for a Healthy Community, the Tri-County Community Health Improvement Initiative in Peoria, Tazewell, and Woodford County that aligns healthcare, health departments, and other agencies towards improving health outcomes. And if a lot of you probably know who she is or have seen her, it's probably been on TV during the entire pandemic. And so that is a face that you should know. Ladies and gentlemen, please welcome Monica Hendrickson.
As a point of clarification, I did graduate in 2005 from U of I. I've been a Illini basketball season ticket holder since then. I bleed orange during basketball season. Even during March Madness, I will pick them to win the whole thing. But on the other side, where my husband does give me kind of the eyebrow rise, is I was born in October in Ypsilanti, Michigan, which is right outside of Ann Arbor. And my mom claims that the doctor moved her planned cesarean so that not to miss a Michigan football game. So I also am go blue during football season. So it's a rough time in my household. But thank you so much. On top of all of that, I was able to meet my husband at U of I and married my best friend. We have two girls that keep us really busy. I always jokingly say at night I become an unpaid Uber driver. And on top of all that, I decided to adopt a dog this week. So it's a lot going on in our household. But with that, I love to talk about the health department and the work that we are doing. And so today, when John approached me about kind of what, to discuss, I wanted to really highlight our new. And so a couple of key takeaways, just so that you guys are aware of kind of what I hope you gather after today, is one, kind of a look at what the new Peoria County Health and Human Services facility has, what's offered in it, and kind of the process we got to get a new building. Kind of what's updated and what are the current services offered at this site, and then what the future holds, because I think there's a lot of just opportunity for us, both good and bad coming forward, but I think we'll navigate it in the best way we can. So a little bit about the new Health and Human Services building. This was definitely a multi-year project. In fact, it really kicked off because Peoria City County Health Department needed a new roof. When I was hired in 2017, one of the first things I did was create a 5-year business plan, which as public health or government officials, you don't really think about. But I created one because I saw we had so much aging infrastructure and how we were able to build up our reserves and make sure that we're utilizing it for this slow and steady kind of model. At the same time, the county started doing assessments of all of the buildings. And so if you're not familiar with the county's facilities, there are a lot of them. And that included 2 of their oldest properties, which was the health department, which had started originally being built at their Sheridan location in 1951, and the coroner's office on Gift Avenue, which used to be the county's juvenile detention center. So you can imagine neither one of these was actually new or been updated in a while. So planning began actually in 2020 and 2021, which if, as I was kindly introduced, I was a little bit busy back then. The entire county was, especially the health department during that period. But really, it was this idea of, can we look at maybe expanding this into a larger project? You know, at that time, we were kicking off those mass vaccination clinics for COVID, and many of you might have heard that we did it out of the old nursing home that the county had, and largely because we didn't have any facilities or options for us that really worked. And so with that, in 2021, the county board actually approved going into agreements with Farnsworth Group for architectural, and then River City Construction for contract or manager at risk and pre-construction work. And so that really kicked off everything into high gear. And so most of 2022 was really spent on assessing and looking at data. And I have a couple of bullet points here, and I don't really want to read through all of them. I will just highlight, at the end of the day, we actually landed on building a new property on our current location. And that wasn't done in a vacuum, but with a lot of data. And in fact, there is a link on this presentation, and I feel free to share that with your members, but that link actually takes you to, for full transparency, a site where all of our data that was collected was reside to make this decision. So they looked at, do we build new someplace else? Do we renovate an existing infrastructure? And then we talked about, where do our clients come from? And so, you know, from the health department, the services we offered, we were looking at, where does the population come from? At the same time, we were not going to be alone on this site. In fact, we were partnering with 2 other county facilities, the Regional Office of Education and the Coroner's Office. And so we also had to ask, in terms of Regional Office of Education, where do your clients come from? And where does your foot traffic come in? Where does it make sense for you to have this? And so, you know, Superintendent Kreider was able to provide data, especially for their testing, their GED programs, where people were coming into. And then it was the coroner, which you might wonder, who is the coroner's clients, so to speak. But we looked at it twofold. We actually looked at it for funeral homes, where a lot of our funeral homes are located and our hospital systems are located, because that's who he works with on a one-to-one basis, but also where he goes for calls, especially really complex calls where a coroner is really required to be there. And a lot of those, sadly, do happen within our urban center. And so based on all the data was collected, they did fantastic mapping of it and assessed everything. They made the decision to actually demolish the old building and build right on top of it, which meant at the end of 2022, we had to start thinking about where we were going to move everyone. And in fact, we actually chose 6 temporary locations. So all throughout 2023 and into 2024, the health department was actually spread out across the county. Our environmental health program was co-located at the highway department. Our emergency management agency was at the bunker, underground bunker for the EMA. We rented out a space that had a dental clinic that we could utilize, as well as provide medical services. We did another medical service at Human Service Center with our partners at Heartland. Our finance and admin team, we were at the courthouse, which was actually nice. We got to meet more of the ROE that way. But we were pretty dispersed for about 2 years. And so that really leads us to the construction period. And so after, what was challenging for us is you'll see, we started moving out in December of 2022, but the actual construction final projects was always in the early spring. And that's because the health department is so reliant on grant funds, we actually have to get all of our sites approved and audited before we can move to them. So we actually had to move out with this, you know, fingers crossed, throwing salt that everything was going to move forward and that we would be able to start that construction, which happened. And I think a lot has to do with our county board and our Board of Health just being really transparent and open about all their decisions. And so even though we had an unofficial groundbreaking in November, which was very, very cold, there was a band there, there was those hot pads in everyone's shoes and gloves. It was miserable but exciting. So we had a ceremonial one where we lifted up dirt that was put down for us. It was exciting. The real demolition, and my nephews were in town, was in July, where they took the bulldozer and took down the building, and that was something to be seen. And then really construction just took off. And so from July until the end of 2024, we've been in construction. And the building, it's been impressive to see it all come through. So 2024, we actually started moving in team members slowly because two of our properties that we were temporarily located were rental units. And so we wanted to make sure we took that liability, took that burden off as quickly as possible. So we started actually moving in mid-construction, which was something to do as well, but we worked through that. And then in 2025, we had our official opening, and we've now been in our location for just over 3 months, and I will say has been fantastic. Before I go on, this is a quick video, which is available on that website, but it just kind of takes everything I said and puts it really quickly. Do I just have to play or?
He'll get it. He just has to switch screens.
I can't remember if this has sound or not, so I apologize.
It does, it's just muted.
So the ongoing joke was all the big milestones in construction, the groundbreaking, the topping of the building, even the ribbon cutting was horribly cold weather. So a little bit about the health department on Sheridan originally. It was actually 4 buildings combined into one. That's why it actually made it a challenge to do any renovation to the structure. And our name kind of talks through that. So we're Peoria City County Health Department, but we're only actually a county entity. And that's largely because the city started a health department in the 20s and early 30s. Does anybody know why you'd want a health department in the 1920s and 30s? Depression, exactly. There was such a spike in disease that the city actually decided to have a health department, and we were located in the basement of City Hall. And then, of course, they thought, oh, this is actually a really good idea. So counties were created almost a decade later. And that health department was located out off of Prospect, just where Trusker's Bakery, just in front of that. The city actually built on Sheridan Road, and because there was a lung clinic there for tuberculosis, which is still one of the largest projects that we do. And then the county joined them on the same site, 2 separate buildings. And then as they kind of realized, hey, we need support, or we're kind of overlapping, they started merging their directors, their medical directors, their nursing staff, and became one entity in the late 70s, early 80s. And so we are just a county entity, but the history still sits in our name as well. The old health department was 50,000 square feet. This building is, 40,000 square feet. This building, even though it has the additions of the coroner and the ROE, it's actually only 50,000. Of hallways, a lot of add-ons over the period made our old building really inefficient. In fact, close to 70% of our building was unused. It was mechanical rooms, hallways. We actually joked there was a toilet per person. I mean, it was pretty much a maze. And so this is a much more higher efficient building, not just in terms of use of space, but actually just upgrade all of our mechanics, all of our systems. And then one of the things I really do appreciate about our county board and board of health is they made the decision to stay on Sheridan. And I think, the county owns all that land. Of course you should stay there. But there's a lot to that. We know very well that some of our neighborhoods are not in the best condition. And a lot of entities are moving outwards, right? Kind of expanding out versus contracting in. And that can take a hit on a community and a neighborhood. And so to build this back in that same location really also was a message to the neighbors to say, we value you, we trust in you, we feel this is a good and safe neighborhood to be in. And so they were able to stay on that site. And so it has been really great to see it. You'll see if you drive by, there's a lot of glass. The question I always get asked is, are you concerned that someone's going to do something? Not at all. In fact, I think our neighborhood's much more protective of it than we are. You'll see them walking around, picking up trash around it in the evenings. They really do love us being there. So once it was completed, we've been able to move in and really just able to celebrate being coordinated as a health department, but then adding in all these different partner agencies. And so I'll highlight that in the next few slides, but as this ends up, you'll see there were so many community partners, so many construction and trades involved in this. It is it was really impressive to see all of it come into play. I think that is it. So just, again, quick things about what it means now to be in this space. So as I mentioned, we do have the Regional Office of Education located there, and the county coroner. The county coroner and the health department, you might not think, how are they, the Regional Office of Education, it makes sense in terms of our client base. But in fact, we are the county's registrar, so all birth and death certificates come through our office. So we actually share a lot of our funeral home compartment. Also, the coroner does a lot on education around some activities or accidents or issues that have a high risk of mortality, so overdose deaths. We do the same type of work. Infant sleep, same with us. They offer cribs, and a lot of times we refer parents over to them. And so it actually has been a building partnership as well. We've always had the Peoria County's Recycling and Sustainability Office there as well, so they moved back. And then sadly, I'll talk about this in kind of the future, we've had a dental clinic at the health department for 75 years. It's been impressive. We've primarily done pediatrics, especially children that have been on public insurance. Sadly, reimbursement rates, we can't compete. And so we had to make a really hard decision about closing our dental clinic. The only saving grace for us was that part of how our dental clinic operated was that we were the pediatric residency program for OSF's dental residency program. So we started a conversation with them actually initially just to be located together, have the adult side, they could rent out space, and we would have the pediatric side right beside it. But over time, I realized, this was actually for sustainability, a long-term partnership. And so the Board of Health actually in October of 2024 voted to close our dental clinic, but really within a month, they actually approved a contract with OSF to take on the entire dental services. So that's actually been fantastic because oftentimes we have families come in, they can address their kids' needs, but adults have the same type of needs or even worse because they didn't have that preventative care. And so this helps that kind of alignment for the whole family. And then one of the early partnerships I did in my career was with Heartland Health Services. A lot of our clients don't have a medical home, so we try to co-locate in the old facility. And so when we came back into the new facility, we were able to bring them back as well. So we do have Heartland Health Services on site. So again, this idea that a client can come in and get everything that the health department offers, the ROE, even the coroner, as well as potentially getting it scheduled for a dental clinic appointment, as well as Heartland, just makes it really comprehensive. And as we know, sometimes our community partners and our friends have like one ride, right? They can call one friend to get them someplace and that's it. Think about how often you drive places it's a luxury for a lot of people. And so it just helped us align our services. In terms of the health department, these are our largest programs that we have. We have an environmental health program that does lead and food establishments. Mr. Barrick is here. He does a great job, everyone. So, but I always like to give it a perspective. If you go anywhere in the county and you find this bar that has only ice in it, that's all it serves is ice, no other food option, we still inspect it. And so we have our environmental health program that does food, septic, and wells, as well as vector and our lead program. We have clinical services, immunizations, and testing is done there. We are the county's only emergency management agency. We combined the city, the county, and the health department's programs into one a few years ago. We have disease investigation, WIC, which stands for Women, Infant, and Children, which is a USDA program to provide nutrition support for pregnant women, postpartum, and kids up to 5. And then we have community health policy and planning, and then vital records, which is our birth and death certificates. In terms of what made this project go forward and kind of the vision of it, really we talked about it in 3 buckets. One was client-centered care, this idea that we had centralized intake. So in our old building, because it was piecemealed, we actually had 5 different waiting rooms for one agency. So if you came in for WIC and you were like, oh, I'd love to have my kids see for dental, like, okay, you're gonna go down the hall, make a left, make another left, and then wait over there. Now it's actually, we have 2 main intake areas. One upstairs for our environmental health and vital records. Those are usually one and done kind of appointments, but then all of our clinical services is one counter and centralized. We've also expanded our clinical spaces. We used to have only 4 exam rooms that were operational. We're now up to 9, which is pretty impactful. And it's also welcoming and warm. No offense to things built in the 1950s or updated in the 1950s and then again in the 1970s and 80s. There was a very kind of sense of styling back then, minimal windows, minimal daylight at times. And so it's much more warm, welcoming. It really brings people in. We also talked about being community focused. So we did talk about the fact that we stay on the same location, but we actually have 2 large spaces that are available for the community to utilize. One is our community room. It fits just over 100. You can do classroom, auditorium, you can split it up. You can do web-based things in there, but it can be used after hours. The best way to say it is a door from the outside that I call the Airbnb door. You can put in a link and you can access it on a weekends for meetings such as this or other civic events. And then we have a community kitchen, which is new for us, and this is what we're really excited about. Our WIC program, which does a lot of nutrition education, we would have the extension office there to come and talk to us about, if you get produce, how do you maintain it? How do you make nutritious food? And so they would actually do it on kind of a table, not in kitchen. And so they're still able to utilize this kitchen for that education, but more importantly, our environmental health program saw a lot of demand. One, for them to teach just classes on food safety, especially to different businesses or operators, but also we get asked a lot about, hey, my mom makes the best guacamole, or my mom makes the best Indian curry, like how do she wants to start selling it. And instead of doing it in a basement or in their home kitchen where there's not a lot of control measures, the community kitchen is available for them to rent as a commissary kitchen and develop their business, then hopefully move it into a brick and mortar situation. So it's almost an incubator, but it's done with the health department on site, which really supports that. And then lastly is employee wellness. One of the things is we talk about is sunlight. We are Midwesterners, we know the value of sunlight. In the old building, more than half of our staff were in spaces that had no direct sunlight or were in the basement. And it makes a difference, especially when you think about the fact, as you mentioned, my home, right? You spend most of your adult life at your office or your workplace. And so we build it to be open spaces where even our directors or coordinators will have glass walls to let indirect sunlight in, but it wasn't just only directors get windows or only so-and-so. All of our staff will know if it's raining or snowy, lightning, they know what's going on outside. So we really did a big focus on that. And then one of the other places was employee designated spaces, especially break rooms. Usually break room is pushed into the corner somewhere, they throw in some folding tables, some chairs and say, oh, there's a vending machine, that's your break room. Our architect noticed when they were doing the design that most of our staff would eat in their cars. They would go and sit outside and roll down their windows and eat in their cars. And so we actually had a designated break area that's upstairs. And if you're not familiar, one of our county board members, Terry Ruland, after we'd valued engineered a lot of this project, he brought back the outdoor patio for us with cost savings. He said, Monica, your team, the whole county, these are hardworking employees, they deserve a place to get away from the difficult work they do day in and day out. And so we have a really great break room, and just talking to John about it, from his work in the ROE, even at the county courthouse, there's not a centralized break room even for employees. So it's actually one of the first county facilities to have something like this. And so it's been well used and well loved by our staff. And I think it's also a recruitment tool for a lot of us now. And then the future of our building. Our board, the Peoria County Board of Health, just approved their strategic plan, and we're focusing on workforce development, mental health, and public trust. And I think public trust in just where good information comes from. So, there's TikToks. I just got an email from my school district. There's a TikTok challenge about putting paper clips in their Chromebooks. I don't understand this, but okay. And so, how do you challenge this, especially with all that's going on? We really are focusing on efficiency and effective service delivery now in this new model. So we're even looking at more and more ways to collaborate. We're about to kick off our next round of our needs assessment as a tri-county, and that's the 2 hospital systems and the 3 health departments. And I wouldn't be honest if I didn't say we're watching a lot of legislation and policies right now. A lot of our programs and on the federal budget, we're seeing $0, not cuts, just eliminations of emergency preparedness, for example. And so, a lot of this is just wading through a lot of the noise and energy to understand kind of where we're going to come up from. And so we're monitoring a lot of that to understand, especially because so much of us is funded by grants and very little from a tax levy locally. So, so those are kind of the things that we are watching and looking forward to as an agency. So with that, that's kind of the formal part of my presentation, but more than happy to answer any questions.
Thank you, sir.
After the fact, what are the big things that you would have done differently from COVID? What are the big lessons that you learned? I would say,
Oh, easy.
if we had to do this again, heaven forbid, what were the big lessons you learned? Start with the easy questions.
I like that. You know, I think I'm going to actually say nothing. Not because, from a work side, I'm going to say nothing. And I'll tell you why. Is we were getting information, especially in the spring of 2020. It was not a fire hydrant. It was the ocean was just getting thrown at you hour by hour by hour. We'd be on a call at 8 o'clock in the morning, and I would have had change in guidance and recommendations at least 7 times before I went to bed. And so I think, you know, I did was a Monday morning quarterbacking, you know, kind of like, oh, I should have done that. I should have done that. And I realized that's when I knew all the information, right? But I think day by day, I look back and I feel very confident that with the information I had at that point in time, I made the right decision. And I think that's kind of how you had to go through this. I will say, though, on a personal note, kind of sharing. So my youngest was in preschool, and my oldest was in 3rd grade. And I did not fully realize my time away from them. That was the biggest impact. So if I could do something different, I would have told myself, this is going to be a long marathon. It's an ultra marathon plus another ultra marathon. You know, we did, I jokingly, you know, say like, this just kept being like a wave after wave, right? And so I think I would have done a better job getting a handle of work-life balance so that I did get home to them, I get to tuck them in or read them a story, but there was a lot of nights that it was, you do that and then I got back to the table and was still working up till midnight and then restarting again at 6 a.m. And so I would think, looking back, and so that would be my personal, it would be how I balanced it with my kids for sure. Thank you.
Monica, thank you for coming in today and sharing this with us. I had a question. Last 10 to 15 years, farm to table has been a big thing. Has the health department partnered with any like area gardens or anything to like source some of the food for that new kitchen?
So the new kitchen, we're not operating anything, so it would be by the vendor that would come in. But we have worked a lot with understanding how to make farm to table easier in terms of permitting, restriction, and understanding that, you know, I feel like Mr. Barrett can speak on this more than I can, but, you know, when we come in and inspect a food restaurant, one of the biggest things we ask is, where's your source? Where are you getting your, you know, goods from, right? And I think working with that understanding of how gardens can help support their, you know, in a food establishment is really key. And so really if a vendor were to come in and they were wanting to do kind of a farm to table avenue, we would be making sure that we were just understanding how we can trace. Our biggest thing about food products and safety is at the end of the phase of food where it gets into consumption, if something were to happen, we just need to be able to walk back where their issues could be. And so I think right now we have a really good working relationship on how to do that with farm to table, and I think that is what we'd work with any vendor that would want to rent that space.
So Monica, as a food service operator during COVID, I just want to say thank you because you yourself and your office was very responsive and kept us very informed during COVID. And anytime I'd have additional questions, which they came up frequently, I did email you, and you did an outstanding job during that time. So I want to let everyone know that. And then a quick question: is your office still doing immunizations?
Yes, we are. So our office, our clinical services, we do immunizations. We have a program that's called VFC, which is Vaccines for Children, and it really helps support kids and families to get vaccinated, get caught up on their vaccines. We also offer private pay for private insurance as well, which I think we just started getting into the private insurance or accepting that here in the past 4 or 5 years now. And so we've expanded that a little bit, but that is something legislatively and policy-wise we are watching as well.
So thank you for being here. You're really good at this. So it was a joy to hear you. So we've learned from COVID that expect the unexpected. And it was scary. And I remember I had rental units and I went around disinfected all the doorknobs in the beginning because we're going to die. I didn't want my tenants dying. So my question to you is, for the future, and there could be a lot of questions in the future, but who can we turn to now to give us the right information, the information that will make a difference? Maybe you're the one. Thank you.
A good question, especially I think seeing what's coming from some of our really well-established federal partners, as well as them cutting or closing down programming, kind of understanding where that sits. You know, I will say that this sounds odd. Social media is fine. I hate to break it. It's going to go away, so you have to actually work with it a little bit, right? But I would say the biggest thing that I would say is do your homework. When you buy a car, right, do you just go straight to the dealer? You have not done anything online. You haven't done any comparison. You're like, yep, that's it. Oh, that's the sticker price? Great, let's go, right? No one does that. I mean, if you do, congratulations. But, you know, I think, though, you know, we do about a lot of things. Even when we're at a grocery store, we see two products that are kind of similar. What do? We kind of compare. We look at the price, we kind of understand. I would say the same thing with information. Don't trust a singular source. But, you know, definitely there are those that are kind of good standbys. I usually, if I'm looking for health information, I do go to the Illinois Department of Public Health. It's one of my good resources. I look at the Mayo Clinic. I think healthcare providers, OSF, has a really good and expanding online kind of library as well. World Health Organization. I even still go to the CDC as well. But I look at different sources to understand to get the full picture. And I would say that's the hard part. That's why our board actually selected public trust as a strategic priority, because people like things just packaged, right? I mean, we love easy buttons. And I think one of the things we are learning now is we have to be really aware of how do we communicate and acknowledge people are wanting the easy button, right? Acknowledging that they may only have one resource that they use to get information, but then bring them into conversations about things. So I would say definitely go to resources, but look at multiple ones just to really get that trusted. And when it comes to your healthcare, in all honesty, your primary care provider. You know, you're having that conversation. I know it's really challenging sometimes to get in and have those one-on-one. I usually have a piece of paper that I write down my random questions, and I make sure I take that with me. But you know, really, those are really good trusted individuals to have one-on-one conversations with.
Thank you for being here today. I was very excited to hear about your commissary kitchen. I get requests probably once a month at Neighborhood House and have to turn them down. So now I know someplace I can send them to. So
yeah,
thank you.
A little bit about that. We do plan to do a full press release and kind of a whole thing about it, because when you are the licensing entity, we can't license ourselves. Just think of that, right? Like, oh, we passed, great, right? Like, oh, that was definitely hand washing over there, you know, all that piece. And so we're actually working with the state as well as our neighboring county, Tazewell County, to come in and do our inspections. So we're actually working through the policy process right now, and then we're gonna, you know, kind of broadcast it widely. Now, the community room, that is something that if you are looking to just rent that space, we actually have that up and running. But the kitchen's going to take a little bit longer because of that layer of that, again, just making sure someone's inspecting us, that's not ourselves.
Absolutely. My question for you is, I've noticed, especially in South Peoria, maybe Jillian, you might have noticed it too, there are many people making food and selling it from their garage, from their driveway. Is that something that, like, how would someone report something like that?
So we get this a lot. So I always, before we go to the garage and the private property locations, the first thing we always do is we always get the call about, there's a taco truck on the corner of Sheridan and Main. I get that question the most. I hate to break it, they have a temporary food permit and a mobile license. So our website does have all those that are active. We do get those complaints. The biggest thing we do is we use social media. Because, one time people are like, it's a private event. Well, if you post and sell tickets publicly on a social media platform, it's a public event. And so then we have to work through that piece with them. And, I will say it's like whack-a-mole. It really is for us. We try to go out and, and that's the group that we really are trying to bring into this commissary to be like, hey, let's do it right. You definitely are trying to do business. Clearly, there's a public that wants it from you. Why not have this commissary kitchen as a way to bridge that for you? Yeah, so we try to go from an education versus regulatory as much as we can.
I'm going to butcher this, but the acronym is PFAS, the polyfluoroalkyl substances that are in nonstick pans and things like that. What's your take on all that information that's coming out on that? It's actually, this is so funny you bring this up. My director of finance recently said, I'm not wearing contacts anymore because of microplastics. I'm like, what? Okay. I think the biggest thing about any type of coating on those type of substances is, one, do your research and your homework, but also maintaining them. How many of us have that one pan that we love that's been coated and clearly has lost it, right? We just don't do a good job throwing it away. And so that's why on default, I always recommend getting some of those materials that are, not have that chemical coating necessarily, because I know myself that I'm lazy enough that I wouldn't throw that away fast enough when it needs to be thrown away.
It might take me a minute.
Two quick things. Jen and I are going to be selling chicken out of our garage later tonight, if anybody's interested. No, you mentioned workforce development as part of your strategic plan. Can you talk about that a little more?
Sure. And I'm hoping the chicken selling is your city of Peoria chicken backyards, maybe, but that's a different conversation. So our workforce development is a little bit kind of divot up. So first of all, our health department is actually a union health department, so we have union staff. One of the things we find is that our mid-management layer that does a lot of great work in kind of how we look at wage scales and compressions. One of the things we realize is their job descriptions haven't been updated, as well as their pay scales really don't reflect that. And I know any of you that work mid-management, you're shaking your head like, yeah, that's a tough area. So one of it's investing in them both from a salary and benefit side, but also training. We bring them in, almost hiring them from our direct line staff, and expect them to be able to lead, right, almost on day one. So a lot of it's putting in a lot of training, and that for mid-management and management. We do have a piece related to benefits, and I think maybe all of you guys know this too. We have a younger and younger population. My favorite was we had a 26-year-old who came in and told me that his paycheck was wrong. Anybody know why? And mom and dad's insurance is no longer in play. I was like, oh, did you have a birthday recently? And they're like, yeah. I was like, oh, there you go. So one of the things we've learned is our staff doesn't understand the value of benefits. They don't understand. We have IMRF, Illinois Municipal Retirement Fund. They don't understand the value of having IMRF. They don't understand how health insurance works at all. They also don't understand like the benefits and, kind of that planned out. And so a lot of what we're realizing is that we have to educate them on that piece. So part of that workforce development is educating them on actually what your full benefits are at the agency.
And so that's a big piece of it. And so between that and just overall training of our staff. And then, you guys had a lot of questions about COVID, but I still think of myself as a new health administrator, which I know is wrong. But in the state of Illinois, there is 96 certified local health departments, so 96 public health administrators in totality. I am now considered in the top third of seniority. That just shows you how much retirement we've had. So we had a lot of administrators that were like, claim it. Some of them were like, oh, I'm just going to get us through COVID and then I'm going to retire. Or I'm not getting us through COVID, I'm retiring early, right? There's a lot of burnout in the field, a lot of that change. And so part of workforce development is re-engaging staff, building up that kind of career path. Yeah, but thank you.